Last week, I was trying to think of speech topics for this interpreting workshop, and I was really running out of ideas. I have quite a few general interests, but nothing sprang to mind. Nothing I knew enough about to make a whole speech out of it. I sat at the table brainstorming with my mother, and like the good GP that she is, she said, "Why not do a speech on contraception?" Fair point, I conceded. I knew more than enough about the topic. Being a woman with a mother who specialised in women's health and sexual health meant that by the time I was 12, I had more knowledge than most grown adults. However, I queried, wouldn't this maybe be a bit off topic for the men? Well, my mother retorted, if it is, then it bloody well shouldn't be. So I thought, okay, she has a point, and that's why I decided to talk to you today about contraception. Like I said, I've always been pretty well versed on the matter, but I wanted to know more about the average situation. And so I found a few statistics from the World Health Organization. So it turns out that contraceptive use has increased in many parts of the world, especially in Asia and Latin America. However, it continues to be low in sub-Saharan Africa. Globally, the use of modern contraception can loosely be summed up by anything involving hormones, sterilization procedures, and modern devices such as condoms. And their use has risen slightly, from 54% in 1990 to 57.4% in 2014. On a regional level, the proportion of women aged 15 to 49 who use modern contraception has only risen minimally or has plateaued during 2008 and 2014. In Africa, it went from 23.6% to 27.6%. In Asia, it rose slightly from 60.9% to 61.6%. Finally, in Latin America and the Caribbean, it rose slightly from 66.7% to 67%. Use of contraception by men only makes up a small part of these rates. Modern contraception for men is limited to male condoms and sterilization, which we also know as a vasectomy. There are many different types of contraception, and WHO differentiates between modern contraception and traditional contraception. So as I said before, modern contraception is any method that involves hormones, sterilization procedures, and devices including condoms. Traditional contraception, on the other hand, is also known as natural family planning and is limited to two methods. One is the calendar method or the rhythm method. This is where women monitor their menstrual cycle and estimate the periods where they're more fertile and periods where they're less fertile. Another method is called coitus interruptus, which is more commonly known as the withdrawal method. Now, the calendar method is 91% effective when it's used correctly and consistently. However, the way people commonly use it makes it only 75% effective. On the other hand, the withdrawal method is 96% effective when used correctly and consistently, but only 73% effective with common use. Given these statistics, doctors nowadays are huge advocates of modern contraception. So I'm going to talk to you about the three main options that apply to both men and women, which is condoms and sterilisation. You'll see why I've only mentioned two things in my list of three later, I hope. First, so we've got condoms, which work by forming a barrier. That's why. There are two types of condoms. We've got male condoms, and these are 98% effective when used correctly, but 85% effective with common use. They have the advantage of preventing sexually transmissible infections, and they're also non-hormonal. The disadvantage is that this method is often used very last minute, and so it's not as safe. Some condoms can't be used with oil-based lubricants because it might damage the condom. Also, condoms are often stored incorrectly. Then secondly, we've got the female condom. This is 90% effective if used correctly, and that's a solid 8% drop from the male condom, and it's only 79% effective with common use. The female condom actually has many different advantages. Firstly, it's made of polyurethane, so it's not made of latex, and it's lubricated. It can be inserted sometime before intercourse and left in place for quite some time afterwards. It also protects against STIs rather, and it can be used with oil-based lubricants, unlike the male condom. It can also be used several times with the same partner and doesn't need special storage. However, it does have a few disadvantages, of course. You need to change it if you change your partner. Also, people have described it as feeling a bit like you're wearing a shopping bag. It's difficult to position. Apparently it makes odd noises, and it can't be used together with a male condom because the friction can maybe damage and even break the material. Then there are sterilisation procedures. Male sterilisation, as I said, is known as a vasectomy. It's over 99% effective from 3 months after the procedure. And then you have female sterilisation, colloquially known as having your tubes tied. The advantages is that once it's done, and you don't need to think about it again. Also, both male and female sterilisation procedures can be reversed. However, there are disadvantages. Like with any invasive procedure, it's going to be a bit uncomfortable. Secondly, even though yes, you can reverse it, there's always a risk that for whatever medical reason, it might not be possible for you. Thirdly, you have the same risks as you would with any other type of surgery. Now, I mentioned that I wanted to speak about methods that apply to both genders. Therefore, I want to discuss something slightly controversial, the contraceptive pill. To tell you a little about the pill. The most common option is a contraceptive pill that works by preventing ovulation. And there are two types. Number one, there's something called a combined contraceptive pill, and it's called this way because it uses two hormones, estrogen and progesterone. If they're used correctly, they're 99% effective, but 92% effective with common use. The pill can be a bit tricky. Without going into too many details, the woman has to take it every day, more or less at the same time, for 21 days. Then she has a 7-day break, before starting another 3-week cycle. There are some pills where it's okay to maybe miss a day or two, depending on where you are in your cycle, but the safest bet is just to take it as recommended. The good thing about this method is that it is said to reduce the risk of ovarian cancer and can also really reduce acne. Then you've got the mini pill, and that only contains progesterone. This one is again 99% effective if you use it properly, or 90 to 97% effective in common use. This one is a bit simpler because it's taken every single day, so there are no confusing breaks. Many mothers like this option because it can be used when they're breastfeeding. I'm going to take a small break here. I think we're about halfway.